Greetings again. Let's resume our conversation on infectious diseases in chapter 15 and talk very specifically about disease prevention and some of the options that you have available there. Again, you can read the introductory slide at your own leisure here, but let's get to it. Disease prevention has some basic components to it. Of course, we have some natural resistance factors. Your skin is, of course, super important for helping ward off and protect you from outside disease-causing agents. As we start to move internally then, of course, your mucous membranes, like in your nasal cavity and so forth, have the ability to help kind of catch or filter some of those disease-causative agents as well. And then there's some normal bacterial flora within your body. If we use an example of that in your stomach, there's a normal bacterial population in your stomach that's very healthy for you. It's healthy to maintain, and it helps you fight off some of the gastrointestinal problems that you may encounter on a daily basis, and helps kind of build some immunity for you to ward off those disease-causing pathogens. So you need to maintain just some basic body component resistant factors, and those are critical. So what influences normal bacterial population? Of course, nutritional status helps us stay on a high nutritional plane. A well-balanced ration, a well-balanced diet for your companion animals helps keep them in a spot where they're very healthy. And whenever you have healthy animals, their immune system functions at near optimal productivity and is able to generate what it needs often to fight off disease. Of course, then we have medication that can help us prevent disease. And lastly, of course, stress. And I've got a picture of a group of cows in a freestall barn here. And it, of course, looks like they're quite comfortable. You've got fans that are running in the barn, and they're all pretty well all except for one animal laying down. That suggests that they're very comfortable and stress-free. Whenever animals, livestock, companion animals are in stressful environments, that gives off a different combination of hormones within the body and makes them more susceptible with disease-causing pathogens that they might be exposed to. So, comfortable, healthy, happy animals will oftentimes be able to fight off disease and prevent it themselves a lot easier. Some other components when we talk disease prevention is, of course, ventilation. And you've got a picture of a farm building here on the top right-hand side of the screen, and a bank of fans that are on the front end of that barn. And that is called what we call tunnel ventilation. It is pulling airflow from one end of the barn all the way through the facility and exhausting out the other end of the barn. And maintaining proper temperature and humidity, minimizing gas accumulation in the facility, keeping dust levels low, and helping remove airborne infectious pathogens is very critical to the function of that particular system, not to mention keeping that temperature and humidity at a very comfortable level for whatever livestock happens to reside in this particular building. So ventilation is super, super important, not just for you and I, but also for our livestock and our companion animals. So let's talk vaccines for a minute. It's important to lay out that most vaccines do not offer complete protection. There are some vaccines for some particular pathogens that, yes, they do basically provide full protection and will absolutely wipe out the risk of any potential disease as far as that goes. But for the most part, under the wrong stressing conditions, under the wrong situation, we can have breakthrough viral infections. So establish some realistic vaccination goals. Provide vaccination to animals that are capable of responding well, meaning they're healthy already. Allow time for immunity to develop before exposing them to risk-causing situations. I'll give you a quick little story here. I worked on a farm at one point in time, and we brought in 3 semi-loads of cattle, and there was about 30 head on each semi-load. So we brought in 90 head of cattle at one time. As they arrived at our farm, we vaccinated those animals. Well, it may sound like a really good management protocol, and in some respects it probably is. But technically those animals are already going through a stressful period. They would already be especially exposed to what we would call shipping fever, which is a respiratory pathogen in livestock. And so they're already at risk for that because they're in the process and they're being exposed clearly to new pathogens as they reached our farm. And so vaccinating them probably didn't provide the maximum amount of immune response we were looking for. It should have been done about 2 weeks prior to them shipping to our location, but again, our operation chose not to do that. So just an example of utilizing vaccines in a smart and proper manner. When we talk about giving vaccinations, of course, there is some risk of acquiring an infection. You can cause an infection by giving a vaccination. On occasion, that will happen when you do give vaccines. Think about your geographic location, in terms of stress, the age of the animal, the sex sometimes, and the functional purpose of the animal. Is it really worth it to vaccinate them? And how much return on your investment do you anticipate getting? In companion animals, we really need to think about disease prevention. Of course, there's a rotor and coronavirus vaccine that's really important for puppies, for example. In farm animals, it is important for us when we have a congregate group of animals in a facility to have some herd immunity to certain things. Decrease the number of susceptible animals in your herd, and then all the at-risk animals are vaccinated. So it's important to really identify and utilize vaccine in a targeted, specific, and intentional manner so that you will get the proper response. There's different types of vaccines, and there's some things that affect vaccine failure. The two types of vaccines are the killed vaccine, where we've taken the pathogen, amplified it, and made a large quantity of the pathogen in the vaccine, killed it so it should no longer cause the specific disease that it's related to, and then we inject that vaccine back into the animal. Usually that elicits a pretty good immune response. Oftentimes requires some booster shots in order to keep that immune response high, keep the antibody titer levels at the level that will help fight off any future disease related to that particular pathogen. The other one, in an abbreviated MLV here, is modified live viral vaccines. So MLVs are, again, we take that virus pathogen, we alter it in the laboratory so that it can no longer have the ability to cause the disease, but we let it remain live. The reason that we do that is it tends to elicit a much higher immune response in the animal that we inject it back into for a much longer period of time, and therefore oftentimes doesn't require as many booster shots. So it's important to utilize and handle that appropriately. Both of those need to be handled really critically. So dirty syringes or storage in the wrong location can render those vaccines ineffective. Certainly then, if we administer them to animals that are too young, poor nutritional status, already exposed to high levels of pathogens, handle it improperly, like I mentioned, it may not function the way that you expect it to. As we talk a few biosecurity or clinical practice things here towards the end of this second mini lecture section, first is biosecurity. Prevent as often as you can introduction of new pathogens onto your farm. It is really critical to figure out how to keep, you've got plenty of stressors on your operation and your livestock with your companion animals. There's plenty of stressors already inherent to your operation. Try and keep as many new ones out as you can, and that's what we call biosecurity. For example, equine infectious anemia. These kind of things are sometimes associated with boarding stables, for example. So if we have we've got 5 or 10 of our own horses and we're asked to board a couple horses for a neighbor, we may not have any of those pathogens. Our horses may already be A, vaccinated, or B, have immunity to equine infectious anemia. But we bring a new kind of strain in with two new horses, we may have an outbreak that may happen if those animals happen to be carrying it. So sometimes we should test them Sometimes we should prohibit them from coming to the farm. Sometimes we should have a protocol, or we should have a protocol in place to prevent that outbreak from happening at our operation. So biosecurity protocols are critical for operations, and I would encourage you to think about recommending them to any clients that you work with, or practicing them carefully when you visit operations. Biocontainment then is minimizing the spread of introduced disease. When we talk about disease can be spread by farm vectors, whether veterinarians, visitors, trucks, rodents, birds, the water supply. Quarantine and proper sanitation to minimize risk of your infected species on your farm. For example, I gave you that story about bringing 90 head of cattle on our farm. Those animals, in addition to maybe some of the mistakes that we made in vaccination, we probably also should have kept them quarantined for 30 days in their own pen so that they were not cross-exposed to other animals. We chose not to do that, and luckily it did not really cause an outbreak in our herd. So sometimes those things don't happen, and that's just sometimes viruses acting like viruses do. So they're very dynamic at times, and we just have to be careful in how we handle them. A few other things here: prophylactic use of antibiotics. If you have an animal that is specifically in acute status, we can utilize a little preventative antibiotic to help just with supportive therapy. It really doesn't replace a vaccination program. It's just supportive and works in concert with other programs. Side effects potentially of vaccinations. Oftentimes at an injection site, there is soreness and potential swelling. Occasionally you might see a little bit of mild lethargy or listlessness, some poor appetite for a day or two, but you have to be aware of potential risk for anaphylaxis, that's shock. And there's other specific animal risks, but make sure that you're working with your veterinarian and understand if you're going to use a vaccination, what are the potential side effect risks that you need to be aware of. Boosters, are oftentimes appropriate, especially if you're using a killed vaccine. So make sure that you read and follow all label directions. Some of them would be yearly, some of them would be longer than that. Some may not need a booster. So make sure that you understand properly with your veterinarian when a booster shot would be necessary. All right, we'll pause there. Again, take some time, grab a refreshment, and get ready for mini lecture 3. Thanks for tuning in again.